And by the way, this question is from David Meyer. Is he in the audience? Thank you so much for providing this. Who here knows what STARS is when it comes to healthcare? 1, 2, anybody? Have you ever heard of STARS? No, okay. So we just have 2 folks that have heard of STARS. David, what is STARS?
I believe it's a ranking system that's given to medical groups, depending on how compliant they are at a certain percentage of getting certain clinical events to happen for their group of patients.
Yep, that's perfect. Yeah. He's hired, right? He's hired. David, go ahead.
Sorry, I cheated. I was working in a private clinic for several years with a good friend.
Right, but isn't this just a powerful moment to think about 7 out of 9 seniors have never heard of STARS, and the work that we do to maximize STARS so that they can use those ratings in helping them pick a plan, right? Pretty powerful. For the 2 folks that do know what STARS is, did that factor into your decision of what plan to pick?
No, not at all.
Wow, David. What were your factors?
Well, availability primarily.
Okay.
And I haven't left the insurance company that I signed up with. Interestingly, very shortly after I chose my doctor and their group, they were censured by the state of California, and I had to switch. That was a huge issue.
Wow.
Yeah.
Wow.
That's a nice switching from one medical group to another. Doctor to doctor's fine, but getting things approved, yeah, it's a massive issue.
And how did you go about that switching? Talk to friends, like what did you?
Well, a doctor I knew personally.
Okay, yeah, no, that's perfect. And how did you use STARS? Do you want to pass the mic?
I didn't know about it. No, I didn't know about it at the time.
Okay.
I now know what it is.
So you didn't use STARS?
I did not use STARS.
Okay.
But I just know what it is.
Now that you know what it is, would you use it to help you pick a plan if you were to switch?
I don't know if I would,
Okay.
I'm not sure if I would.
Got it. No, that's really...
I wouldn't. If I saw a 5-star plan, it would catch my attention, but I'm not sure it's a determining factor.
Sure. No, that's great. Thank you. Now, anybody switch in the last couple of years or thinking about switching? You're in the middle of
I'm going to
thinking about it.
Yeah.
Right, exactly. And mostly it's cost-driven, right?
Yeah, yes.
Yep. Anybody else? Switchers? Yeah. I'll start with you.
Yeah, I'm considering changing carriers based upon premium.
Premium.
So I've had 2 carriers. First one was not very good at billing, so I got in between the doctor and the insurance company, and I'm paying my sup premium, and I think I'm in the medical billing business. So and I don't know what I'm doing, and after a while I said I don't really want to learn this task. So I got rid of, actually the company is no longer around. I think they were bought by Cigna.
Okay.
It was Sterlington.
Okay.
And now I'm with Mutual of Omaha, and I have no complaints, but I know that my premium's higher than what it should be.
Got it.
So.
No, terrific answer. Very articulate. Thank you. Anybody else?
Me.
Okay.
Here.
Yep.
I'm thinking about it only because they changed locations recently, and they went a whole lot bigger operation, and the communication is lacking between the doctors and the pharmacy, between the doctors and the X-ray imaging healthcare or whatever they send you out to, and I'm having a really hard time getting everything connected.
That's terrific.
Yeah.
Kathleen, you almost like set up my next question around communications.
Okay.
I love it. So thinking about communications, but let's think about it. I know, there's some integrated plans here in California. Think about it primarily from the health plan perspective. Would just love to hear from you on, first off, do you think it's the right amount of communications? Are you reading these communications? Are you acting upon them? I'm happy to take a volunteer. Ken, you've got the mic, so let's start with you.
Okay, I was prepared with my other question.
Oh, sure. Okay, answer the other question. No, I love it. Go ahead. This is why I love
I'm
groups.
thinking of switching groups just because I was with the federal government and my choice wasn't that good. And
Okay.
now I think I'm going to drop that and go with a secondary in like an Advantage plan through Medicare, where I have a lot more choices, and if I can see my provider there, then I'll probably drop what I have and go that way.
And now that you understand and have heard about stars, would that impact your decision, do you think, this rating system?
I was going to ask that question also, but when you're looking through all these plans, are they recognized in the information that you're looking at that they are star?
You're saying you don't see it?
No, well, not when I was looking at the federal providers for the federal government.
Sure.
Yeah. So now that I know that, do you see that when you go in and look at all the information? Is it, say, like it's a star group, or how is it designated?
David, do you want to handle that one? Can you see when you go in, when you were looking, that what the stars impact was, or was it easy to find?
Tying in with your communication, it is just ridiculously overwhelming. If you're looking for a specific piece of information, my wife is in the process of signing up for Medicare. It's insane. We ended up going to a community advisor and just defaulting to the program that I currently have. The risk of going to another program and having missed something that I'm not able to get, you know, by moving, or for her going into a program that's different from mine, is not worth the effort.
Got it. Wow.
So you ought to focus your question a little bit